Have you ever wondered how to treat food poisoning or allergic reactions? Stay tuned and we will teach you how. Let's start with the first aid for food poisoning. If you have ever felt ill after consuming some food, there is a high chance what you experienced was food poisoning. Food poisoning refers to any illness that is caused by consuming spoiled, toxic or contaminated food. Most cases of food poisoning result from food being contaminated by various types of bacteria and virus. Thankfully, food poisoning is not life-threatening and in most cases, the symptoms go away by themselves without the need for medical attention. Here are the first aid for food poisoning. 1. Rehydrate. Drink liquid to protect against dehydration. Electrolyte solutions like Gatorade works, but anything except milk or caffeinated beverages will do. 2. Avoid certain foods and substances until you're feeling better. Avoid solid foods, alcohol, carbonated drink and dairy products until diarrhea has stopped. 3. Try to keep the person calm and get some rest. Diarrhea and vomiting can weaken your body and might be tiring, so you might need some rest. 4. Ease back into eating. Avoid hard-to-digest foods. Gradually begin to eat bland, low-fat, easy-to-digest foods, such as toast, gelatin, bananas and rice. 5. Help the person lie on their back. Rest either sitting or in a propped lying position. Activity may worsen nausea and may lead to vomiting. 6. Raise their head about 12 inches. Keeping your head elevated about 12 inches above your feet helps reduce nausea. 7. Turn them on their side if they are vomiting. 8. Make sure their clothing is loose so they can breathe. Making their cloths loose might be the best and immediate way. 9. If the symptoms are severe, prolonged or get worse, transport the person to a medical facility. Although food poisoning is not life-threatening, we must take it seriously. The best way to avoid getting food poisoning is to ensure you maintain high standards of personal and food hygiene when storing, handling and preparing food. Now let's proceed to the first aid for allergic reaction. Some people are severely allergic to certain foods, chemicals and medications, or to injected venoms following a bite or sting. An allergic reaction can be severe, and cause people to die. Here are the first aid for allergic reaction. 1. Stay with the patient and ensure total rest. Rest can slow the reaction. Allow the patient to rest in the position of greatest comfort. Often the patient will want to sit up if there are breathing difficulties. 2. Give any prescribed medication or treatment. Some allergic patients carry prescribed medication with them in the form of a tablet, puffer or a self-administered injection of adrenaline. If necessary, assist the patient to find and administer their prescribed dose of medication. 3. If the reaction follows exposure to a chemical, wash the contact or thoroughly with copious amounts of water. 4. Don't give any medicines that you are not sure about and that is not prescribed. Some medicines can trigger the reaction more worse. 5. Observe the patient closely. If the patient becomes unconscious, lay them on their side. If it gets worse, call for the ambulance and bring the patient to a medical facility.